Are you looking for a solution to balance your emotions? In this Effexor XR review, we will explore the pros and cons of this popular medication. Effexor XR is known for its effectiveness in treating depression and anxiety by regulating the levels of serotonin and norepinephrine in the brain. This prescription medication has gained recognition for its ability to improve mood and alleviate symptoms of emotional instability. Whether you are considering taking Effexor XR or are simply curious about its effects, this review will provide you with valuable insights. We will delve into the benefits and potential side effects, allowing you to make an informed decision about whether Effexor XR is the right choice for you. Join us as we analyze the efficacy and safety of Effexor XR, providing a comprehensive overview of its advantages and disadvantages. Let's explore the world of Effexor XR and unravel its potential to bring balance into your life. Understanding the role of Effexor XR in balancing emotions. Effexor XR, also known as venlafaxine extended release, belongs to a class of medications called selective serotonin and norepinephrine reuptake inhibitors, SNRIs. It works by increasing the levels of serotonin and norepinephrine in the brain, which are neurotransmitters responsible for regulating mood and emotions. By restoring the balance of these chemicals, Effexor XR aims to alleviate symptoms of depression and anxiety, bringing about a sense of emotional stability. Effexor XR is primarily prescribed for the treatment of major depressive disorder, generalized anxiety disorder, and panic disorder. It is believed to work by inhibiting the reuptake of serotonin and norepinephrine, allowing these neurotransmitters to remain active in the brain for longer periods. This extended action helps regulate mood, reduce feelings of sadness or worry, and promote a sense of well-being. While Effexor XR may be effective for balancing emotions, it is important to note that it is not a standalone solution. Therapy, lifestyle changes, and support systems play equally important roles in managing emotional well-being. Effexor XR should be used as part of a comprehensive treatment plan, under the guidance of a healthcare professional. Pros of using Effexor XR for emotional balance. Effexor XR offers several potential benefits for individuals seeking emotional balance. Let's explore some of the advantages of using this medication. Effectiveness in treating depression and anxiety. Effexor XR has shown efficacy in reducing symptoms of depression and anxiety. Clinical studies have demonstrated its ability to improve mood, reduce feelings of sadness and worry, and enhance overall emotional well-being. Regulation of serotonin and norepinephrine levels. By targeting the reuptake of serotonin and norepinephrine, Effexor XR helps restore the balance of these neurotransmitters in the brain. This regulation can promote a more stable emotional state, reducing emotional fluctuations. Long-lasting effects. Effexor XR is an extended-release formulation, which means it provides a steady release of the medication over time. This allows for a consistent therapeutic effect and minimizes the need for frequent dosing. Flexible dosing options. Effexor XR comes in various strengths, allowing healthcare professionals to tailor the dosage to individual needs. This flexibility ensures that the medication can be adjusted to achieve optimal results. Additional benefits for some individuals. In some cases, Effexor XR has been reported to improve energy levels, concentration, and cognitive function. These additional benefits can contribute to overall emotional well-being. While these advantages make Effexor XR an appealing option for individuals seeking emotional balance, it is essential to consider the potential drawbacks as well. Let's explore the cons of using Effexor XR for emotional balance. Cons of using Effexor XR for emotional balance. While Effexor XR has its benefits, it is important to be aware of the potential drawbacks before considering this medication for emotional balance. Side effects. Like any medication, Effexor XR can cause side effects. Common side effects include nausea, headache, drowsiness, dizziness, and sexual dysfunction. These side effects may vary in severity and can impact an individual's quality of life. Withdrawal symptoms. Discontinuing Effexor XR can lead to withdrawal symptoms, such as dizziness, nausea, fatigue, irritability, and brain zaps. These symptoms can be uncomfortable and may require a gradual tapering off of the medication under medical supervision. Interactions with other medications. Effexor XR can interact with certain medications, including monoamine oxidase inhibitors, MAOIs, linezolid, and methylene blue. These interactions can lead to potentially serious side effects and should be carefully monitored. Individual response and variability. Effexor XR may work well for some individuals, while others may not experience the desired effects or may find the side effects intolerable. It is important to consider individual variability and potential trial and error when starting this medication. Pregnancy and breastfeeding considerations. Effexor XR is not recommended during pregnancy or breastfeeding due to potential risks to the fetus or infant. If you are pregnant or planning to become pregnant, it is crucial to discuss your options with a healthcare professional. It is essential to weigh these potential drawbacks against the benefits of Effexor XR, considering your individual circumstances and needs. Consulting with a healthcare professional will help you make an informed decision about whether Effexor XR is the right choice for you. Exploring the side effects of Effexor XR. As mentioned earlier, Effexor XR can cause side effects, although their occurrence and severity may vary among individuals. It is important to be aware of these potential side effects before starting this medication. Common side effects of Effexor XR include nausea and gastrointestinal discomfort. Nausea is one of the most commonly reported side effects of Effexor XR. This symptom may be more pronounced during the initial weeks of treatment but often improves over time. Taking the medication with food or as directed by your healthcare professional may help alleviate this side effect. Headache. Some individuals may experience headaches while taking Effexor XR. These headaches are usually mild and transient, resolving on their own or with over-the-counter pain relievers. If headaches persist or worsen, it is important to consult with your healthcare professional. Drowsiness and dizziness. Effexor XR can cause drowsiness or dizziness, especially during the initial stages of treatment. It is important to exercise caution when engaging in activities that require alertness, such as driving or operating machinery. If these side effects become severe or persistent, it is recommended to seek medical advice. Sexual dysfunction. Effexor XR can affect sexual function in some individuals, leading to decreased libido, difficulty achieving orgasm, or erectile dysfunction. If these side effects are bothersome or interfere with your quality of life, discussing them with your healthcare professional is important. Sweating and hot flashes. Effexor XR may cause increased sweating or hot flashes in some individuals. These side effects are usually mild and tolerable, but if they become bothersome or significantly impact daily life, it is advisable to consult with your healthcare professional. It is important to note that these side effects are not exhaustive, and individual experiences may vary. Some individuals may not experience any side effects at all, while others may experience a combination of these or other less common side effects. If you have concerns about potential side effects, it is essential to discuss them with a healthcare professional before starting Effexor XR. Dosage and how to take Effexor XR. The recommended dosage of Effexor XR for the treatment of depression and anxiety varies depending on individual needs in response to the medication. It is crucial to follow the dosage instructions provided by your healthcare professional and not exceed the prescribed amount. Taking Effexor XR in higher doses or more frequently than recommended can increase the risk of side effects. Effexor XR is available in capsule form and should be swallowed whole with water. It is usually taken once daily, with or without food, at approximately the same time each day. The extended release formulation of Effexor XR allows for a steady release of the medication over time, providing continuous therapeutic effects. It may take several weeks for the full benefits of Effexor XR to be realized, so it is important to continue taking the medication as prescribed, even if improvements are not immediately apparent. If you miss a dose of Effexor XR, it is generally recommended to take it as soon as you remember. However, if it is close to the time for your next scheduled dose, it is best to skip the missed dose and continue with your regular dosing schedule. Taking a higher dose to make up for a missed dose is not recommended. It is important to note that dosage adjustments or discontinuation of Effexor XR should be done under the guidance of a healthcare professional. Abruptly stopping Effexor XR can lead to withdrawal symptoms, and a gradual tapering off of the medication is often recommended to minimize these effects. If you have any concerns or questions about the dosage or how to take Effexor XR, it is crucial to consult with your healthcare professional. Effectiveness of Effexor XR in treating emotional disorders. Effexor XR has been extensively studied for its effectiveness in treating various emotional disorders, including major depressive disorder, generalized anxiety disorder, and panic disorder. Clinical trials have shown positive results, indicating that Effexor XR can be an effective option for individuals seeking relief from emotional symptoms. In a study published in the Journal of Clinical Psychopharmacology, Effexor XR was found to significantly reduce symptoms of depression in individuals with major depressive disorder. The study compared Effexor XR to a placebo and concluded that the medication was superior in reducing depressive symptoms and improving overall well-being. Similarly, Effexor XR has shown efficacy in the treatment of generalized anxiety disorder. A study published in the Journal of Clinical Psychiatry found that Effexor XR significantly reduced anxiety symptoms and improved overall functioning in individuals with generalized anxiety disorder compared to a placebo. Effexor XR has also been studied for its effectiveness in treating panic disorder. In a study published in the Journal of Psychopharmacology, Effexor XR was found to be effective in reducing panic attacks and improving overall quality of life in individuals with panic disorder. These studies provide evidence supporting the effectiveness of Effexor XR in treating emotional disorders. However, it is important to note that individual responses may vary, and not everyone will experience the same level of improvement. Consulting with a healthcare professional is crucial to determine whether Effexor XR is the appropriate treatment option for your specific emotional needs. Alternatives to Effexor XR for emotional balance. Effexor XR is just one of several options available for individuals seeking emotional balance. Depending on your specific needs and circumstances, other medications or non-medication treatments may be more suitable. It is important to discuss alternative options with a healthcare professional to determine the best course of action for you. Some alternatives to Effexor XR for emotional balance include selective serotonin reuptake inhibitors, SSRIs. SSRIs, such as fluoxetine, Prozac, and sertraline, Zoloft, are commonly prescribed for the treatment of depression and anxiety. These medications work by increasing the levels of serotonin in the brain and can be effective in promoting emotional well-being. Cognitive behavioral therapy, CBT. CBT is a type of therapy that focuses on identifying and changing negative thought patterns and behaviors. It can be highly effective in treating depression and anxiety and may be used as a standalone treatment or in combination with medication. Other SNRIs. SNRIs similar to Effexor XR, such as duloxetine, Cymbalta, may be considered as an alternative. These medications also work by increasing serotonin and norepinephrine levels and can be effective in managing emotional symptoms. Lifestyle changes. Implementing healthy lifestyle changes, such as regular exercise, a balanced diet, stress management techniques, and sufficient sleep, can significantly contribute to emotional well-being. These changes can be combined with medication or used as a standalone approach, depending on individual needs. Other therapy options. Depending on the specific emotional disorder, other therapy options, such as interpersonal therapy, IPT, dialectical behavior therapy, DBT, or acceptance and commitment therapy, ACT, may be considered. These therapies focus on different aspects of emotional well-being and can provide alternative approaches to managing symptoms. It is important to remember that finding the right treatment option for emotional balance may require some trial and error. What works for one individual may not work for another. Consulting with a healthcare professional who can assess your specific needs and tailor a treatment plan accordingly is crucial in finding the most suitable approach.